All right. Thank you so much for staying with the Monday Report. Use the hashtag Monday Report. We'd like to hear your views at Trevor Mbija at Citizen TV Kenya. Everyone is still with me. Dr. Mohamed Kuti, the governor for Isiolo and COG Health Committee Chair, is still here. Dr. Mwachonda Chibanzi, Acting Secretary General, KMPDU, is also here. Cherotich Sei, an active citizen. Nerima Wako Jiwa, Executive Director, Siasa Place, and Paul Masese, tuning in live from Nakuru, is also with us. And let's bring in the governor back on this again. I have a tweet here from Turanira Kaugiria, who's saying county preparedness for COVID-19 includes adequate numbers of trained and well-enumerated protected healthcare workers. Can we confirm this from the county level? Governor.
Yeah, I think I had spoken to that when I said, number one, the training is very crucial. And I said about 17,500 health workers have so far been trained. And I had said this is not a switch, it's a progression, and we are heading there. Secondly, the community health volunteers, who actually are our first line defense, we have now trained a total of 60,000 community health volunteers. In my county, for example, all the public health facility workers have been fully trained, 100%. But like we have trained 613 out of the 554 public health workers, those who are working in public health facilities. But the 613 above the 554 is because we now have started training those who work in private health facilities. So I think on the training part, we're doing well. The PPE, I had already spoken. I said KEMSA has a PPE worth 2 billion Kenya shillings, and just today we got communication from the Council of Governors Secretariat that counties should not spend their own money on PPE because now we have enough stock to be able to, and more will continue to be stocked at KEMSA. Yeah. And therefore, we just do draw down from KEMSA. And therefore, that actually, we're doing very well.
Okay.
The issue of remuneration, you know very well, His Excellency the President had put 3 billion in the budget for the health workers top up as allowances for those who are in the frontline workers, especially the health workers. So that, I think, is now at an advanced stage of being dispersed to the health workers. So I must say, this is a war. I don't think we can fully say that we now have well-motivated, remunerated health workers.
Yeah.
But this is a war. We need patriotism, and we need to. But we have to do our part as government. We have to do our part as citizens, and we have to do our part as health workers. And so far, I must say, I really appreciate the patriotism our health workers have shown. I really appreciate the fact that they are there, especially in early days when the PPEs were not this much available.
Yeah.
But right now, I think in terms of protecting them with PPEs, we have enough stock. Remuneration will never be enough. That's where patriotism comes in. But the government has actually shown a gesture, a very good gesture.
Okay.
So I think that question, we're working on it, and we will continue. There are counties, obviously, where there are issues.
Yeah.
There are lots of push and pull. Even in a few of them, there has been strike notice. I think now we are continuing to resolve that county by county.
Okay.
But I think this is where we all have to give our best, because this is the time to give. There are people who are hungry. Neighbors have to look after each other.
Okay, Governor, there's another question here for you.
Care about one another. Therefore, in the same way, the health workers, and I really appreciate the way they are offering themselves, but also they are being taken care of as much as we are able as
Governor, there's another question here for you.
national.
Governor, there's a question here for you from Mike1 on Twitter. He says, as the numbers rise beyond expectations, what measures are there at the county level to ensure there is no discrimination when it comes to the demand for available resources in the counties?
Well, I think that's a very, very good question. I think we need to make sure that all those who are affected or infected are taken care of with equal passion and be able to have available resources caring for them. But I think there's something that I have not mentioned, which is very, very crucial. The fact that now we are going towards home-based care, because as the numbers surge, and it has now shown very clearly that as much as in the rest of the world, about 5 to 6% require admission. Ours is half that. It's about 2.5%. Therefore, quite a large number of COVID positive cases don't even require admission. And therefore, it is now very apparent from the experience we have had over these 100 days that majority of cases are not going to require admission into hospitals. That's why we should not overload our facilities, our isolation facilities, so that we now train and create awareness on home-based. And I think this is where now mothers, especially gender issues, need to be looked at. This lockdown has brought a lot of gender-based violence. That also needs to be addressed. And you know, in my county, for example, we are now talking this even on the local radio, trying to create awareness and trying to ensure that those who have any such issues should come out and report. So I think the best preparedness, as far as I'm saying, is that while the government and the health facilities get prepared, the families also need to get prepared, need to know how to care for positive cases should that happen, how to isolate them, how to make sure that they are fed without being infected, how even to keep the rooms aside so that the rest of the family don't get infected. And I think if we combine the home-based care and also the facility care, and we continue improving our facilities on a progressive way, then I am sure we'll be able to manage. And in any case, I want to say that so far we are doing much, much better than countries that socioeconomically are much better endowed than Kenya.
Let me bring in Dr. Mwachonda Chibanzi on this. Dr. Mwachonda, as healthcare practitioners, what more would you like to see on the ground so that you're sure that we are winning this fight against COVID-19 and we are ready to reopen? What more would you like to see?
Trevor, so for me, the starting point is to say that I've always said that we all have responsibilities to play in this COVID-19 pandemic. First is that the government has its responsibilities. As healthcare workers, we do have our responsibility, and the public also equally has a responsibility. But before I highlight what I'd like to highlight is that I heard the governor indicating that there's a lot of whining. Just to remind him that as a political leader, these are concerns coming from various people. Us as healthcare workers, teach on behalf of the public, Rima also on behalf of the youth. So as political leaders, they need to listen more to what people are saying. And I agree that this is a balance between the economy and our health system preparedness. So essentially what needs to happen moving forward is that whatever needs to have been implemented needs to be implemented immediately. I think it's quite clear in terms of the healthcare facilities. And it's also an opportunity for government to now set up robust social protection mechanisms, ensure that those who are underprivileged in our society are well catered for. I think we've seen the Ministry of Labour are coming up with a program that to try and at least cushion families that are not able to cater and provide for themselves during this time of the pandemic. So essentially, what needs to happen is that not just the healthcare system, even the economy, in terms of ensuring that everyone now has space to be able to get their livelihoods.
Yeah.
And it comes to the healthcare system, that because the reality is people are going to get sick, and with more people getting sick, they'll still come back to the same facilities, even as we already have home-based care. So facilities need to be prepared, human resources availed to ensure that we can respond to this.
Yeah.
And also the people who are underprivileged in our society are also taken care of there. So basically that holistic approach is the most important thing in this pandemic. And of course, reopening is not floodgates at once. It has been slow reopening. I think what we've seen so far from the last presidential address was that certain measures, the curfew was extended to 4 a.m. Then some of the counties, inter-county restrictions were lifted. So perhaps what you're looking at is perhaps certain extension of some of the measures, perhaps even reopening some of the counties like Mombasa and they are currently remaining, and perhaps seeing, are we going to lift the curfew in total or not? You see, those are some of the balances that need to be put in place.
Okay. Jerotich say there seems to be a clamor or a claim that now it boils down to the citizens themselves to flatten the curve. There's only so much the government can do. Do you agree with this analogy that then now it now boils down to the individual rather than pushing the back to the government?
This has never been, Trevor, about the individual insofar as we are patronized and gaslit by the government, telling us that we are the ones who are the cause for the continuous spread. We are not socially distancing. We are not observing hand washing. We're not wearing masks. It always seems to come back to the individual. And I want to take it straight back to those bureaucrats in their ivory towers. And with due respect to Governor Kuti, listening to all the quantitative details around preparedness does not in any way give me a sense that this is a government that has put people at the center of planning in terms of this COVID response. I'm also quite surprised to hear that we're doing so much better than so many other countries that are socioeconomically better than us. I'm very surprised. I would like to find out how it is that Governor Kuti's Isiolo County, for example, is responding to the issues of the socio-economic breakdown. For example, how many people are part of the Inua Jamii program? How many? How many have received assistance? Can you hear me, Trevor?
Yes, you're good.
I feel like, sorry. How many have received assistance? Sometimes Inua Jamii feels like Angamiza Jamii. You think of the woman at the coast who boiled stones for her children. You know, I feel that all this planning that is happening is knee-jerk, and it is myopic. It is starting in the middle. It's not placing people at the center of the response. So we can count beds, we can count ventilators, we can even count masks. And we know that the consignment, the donation from Jack Ma has gone missing in action. But ultimately, we will be faced with an audit report 1 or 2 years down the road telling us that funds that were made available for COVID response were mismanaged. But before we get into the expansive biomedical reasons, we want to be sure, we have to ensure that people are comfortable. And this is what we have been trying to push the government to reflect on. We have a Kenya COVID Emergency Response Fund. We have all these emergency response committees proliferating across the 47 counties. And very seldom do we hear concrete feedback as to what exactly has happened to cushion the citizens. We are less interested in beds and more interested in how people are actually going to feed their families. If we are talking about home-based care, which might become a reality, and we have people whose livelihoods have been destroyed, we have people who don't have access to sufficient water and sanitation and necessary ablutions, we have people who are taking care of children who are not back in school. How are we going to actually pass the duty of care back to a citizenry that is not capable of taking care of itself. So I listened to the governor with a high level of dismay and say this is exactly what the problem is in Kenya today. If we open our mouths, we are told we are whining. And then we are compared to other countries and we're told we're doing better than those other countries. But ultimately, if you went to the homes of men, women and children who have slept hungry tonight, who don't know where their next meal is coming from, who are also suffering from other underlying conditions, existing conditions, who are elderly. You know, I just say that we are completely off the mark. I'm not a biomedical, I'm not a public health specialist, I'm not a medical doctor. We leave that to them. But from the socio-economic perspective, we can really see how the government of Kenya has failed people.
All right. Governor, I'll give you a chance to respond to those concerns there. One of them being accountability, the other one being the socioeconomic buffers for the people on the ground. What are you doing about that?
Thank you. I think I would like to take back the whining part. I think maybe all I meant is that we are in a war, and when we are in a war, we need to be in that gear. Whether you are government, citizen, you know, we are being faced by an enemy. And when we are being faced by an enemy, I think, you know, it's like when a house goes on fire, you pick anything to make sure that you put out that fire. And then, you know, so this is a concerted effort that I meant that I wanted to cultivate that spirit of togetherness, spirit of patriotism, spirit of knowing that we are having a serious challenge, that then we all have to play our part as government. I mean, accountability is very crucial, making sure that the little resources in our hands are utilized properly in order to make sure that we alleviate suffering, we avail the medicines or the protective gear and the training, and all that is required as government, having to make sure that the beds are available. That's the responsibility of government. But since this is a disease that is also requires, we must admit that it's not turning the responsibility on the citizen. It's just that certain activities that have shown to slow down the progress of the disease are actually individual in nature. Putting on a mask is an individual responsibility. Of course, the government has to avail those masks. Of course, the government has to create that awareness as much as possible. But eventually, the wearing of masks is an individual responsibility. The staying 1.5 meters or so away from someone in a market is an individual responsibility as much as it's also a communal responsibility. But this is where now I think the less we point fingers and the more we become patriotic in sticking together to face this disease will actually give us the upper hand.
Okay.
And I think it's also, it has been shown in times of crisis, the most positions that people should take is that togetherness. And obviously in this togetherness, there has to be accountability. So the issue of accountability should never be forgotten, especially by those who have been given responsibilities to manage public resources, whether that is at the county level and at the national level. But at the same time also, the citizenry, in this, especially in this particular disease, which is a highly infectious disease, the individual responsibility is a very, very critical aspect.
All right, Governor.
But also supporting the lower, I mean, the more vulnerable members of our community is also the responsibility of government. And I am sure the government has, in the fiscal space available, done its best because the Ministry of Labor has geared up the social protection programs.
Okay.
There are now people receiving funds through M-Pesa.
Yeah.
There is support. The county governments have invested in food to support the vulnerable groups. So that, but I cannot say it's adequate.
Okay.
Because our country also is endowed, and we should not run away from the fact that countries are endowed differently.
Okay.
That's a fact also.
All right, Governor. Let's bring in Nerima Wako on this, and then we wind up the discussion. Nerima Wako, you're joining us live now. You're the Executive Director, Siasa Place. Nerima, the youth are on the spot on this particular one for probably going beyond the regulations that have been set by MOH. You interact with them a lot. What are their concerns right now? And this is now becoming an issue of individual responsibility, the same conversation I was having with Jerotich Sei Ali.
Yeah, I would agree that their concerns at the moment is the economy, prioritizing the economy, access to basic needs. We cannot forget that most young people are in the informal sector, and being in informal, it's necessary for them to do manual work, to get out of their homes. They cannot have a way of living over the internet and working from home. But also, when this virus first entered the country, the venues that were first to be sacrificed were maternity wings in the counties, which again, it's mainly women below the age of 35 who are childbearing age, and also those that became isolation centers are institutions. Okay. So as much as we're talking about going back to school, what will happen when people are now doing social distancing in institutions, when now we are still using them as isolation centers? But lastly, what I need to talk about is, as much as Governor Kuti is talking about us being one, over the weekend, we saw politicians in central Kenya gathering and politicking without any social distance. And what we are witnessing is that politicians are free to actually move without practicing regulations that the Ministry of Health is overemphasizing on young people to do. And so there's a bit of unfairness and a bit of double standard when it comes to that aspect. Not everybody is following the regulations clearly, but there are some who are slapped on the wrist harder compared to others.
Okay. Masese, let me hear your remarks in terms of the personal responsibility that has now been posed to the citizenry. Paul?
Thank you, Trevor. I think I agree with everything that Sei said. Yes, individually, we have a responsibility to adhere to the directives aimed at containing the spread of the disease. But then I think the bigger responsibility we have as citizens is to hold the government to account. Right now, as we speak, I am worried that the governor is not concerning himself with why are the people not observing social distance? Why are people not wearing masks properly? Part of the reason is because people see what the government is doing. Out here, people are saying that actually this COVID-19 is a cash cow. That the government is seizing the opportunity to raise money from poor Kenyans, to borrow loans uncontrollably, to loot, because as it were, accountability concerns every time there's a crisis, it's an opportunity for people in public spaces to loot.
Yeah.
So Chancellor Winston Churchill said, this crisis is good as its part. We should not let it go to waste.
Okay.
I think if there's anything we should learn from COVID is that all the time we are left to our own elements. We become useful to this government only when elections are around the corner. And so Governor Kuti and his 46 other colleagues right now and today have a responsibility to become more accountable to us and to stop, as it were, pushing blame on us. It's not like Mama Boga, would want to die of COVID, but would she want to die of anger? Would she want to watch her babies? We just watch the news from Naivasha, where a mother killed her 4 children.
Okay.
That is stress.
Okay.
People are sinking into depression, and the government doesn't appear to be doing anything about it.
Okay.
We cannot afford to wait any longer, really.
All right. Let me bring in Governor Kuti to wind up on this very briefly, Governor. Governor, there's a lot of complaints here about whether the counties are prepared or not. You're the Isiolo governor. Are there any guarantees for the people of Isiolo today, because they are also marginalized? What would you like them to judge you by? What would you say is your legacy, so to speak?
Well, I think this is a very long question for this short time. I mean, rather, it requires quite some longer time to answer. But in brief, I must say that as far as this COVID preparedness is concerned, I think in my county we have tried our best. We've formed those committees, as I've said. We've done 100% training of health workers, public health workers. Now, actually, we are flowing into private facilities. We've recruited health workers. We are working very hard. We have a biosafety level laboratory that we are working very hard to get to be accredited as a regional COVID testing center.
Yeah.
We have the rapid response team in place, including an epidemiologist. We have gone on radio every Thursday, other than the last Thursday. I've been moving to Isiolo as much as I am in the National Emergency Response Committee. I also attend every Thursday our county COVID committee, and I must say to the earlier speaker that the COVID committee is meeting once a week because the lower level committees meet on Monday, then the sub-county, like that, up to then on Thursdays we meet in order to receive the report from the lower administrative units, so that then we have a comprehensive report on Thursday, including the referral facility. And we look at how prepared are we always? How much PPEs do we have? Have we improved on the isolation wards? How many cases have we gotten this week, and have we done contact tracing? And I think that has helped us to the extent, and we also announce this every Thursday to the people and explain to them to be more vigilant. We work with the county commissioner in the town to assess areas. We have both entries of Isiolo from Nairobi side and from the Marsabit side. We test temperature, we have hand washing facility, and we even have the body sanitizer, the walk-through. At the hospital also, we have the sanitizer, the walk-through, and therefore we have, like our first case, the patient was in a bus, therefore, and the bus actually traversed the whole county. But because of the network we created for the community health volunteers and the Mbakumi, we were able to trace almost 90% of those people and quarantine them, and thereby prevented and tested them. And because of that, all those people actually could not spread. Up to now, we do not have community spread. We still have the 9 cases we get are all now from outside. Only now our prison actually is our concern, because we have 4 active cases within the prison. And I think we have tried our best. But overall, we have improved our own source revenue from 86 to 114 and then to 161 in our second year. We have gotten, for the first time in Isiolo County, the 2 years I have been there, we've got qualified opinion from the Auditor General, which the previous term has never been found.
Okay, Governor.
We have put ECD, quite a lot of health centers. We have improved the distances between health facilities. When I came, I said it was 49. We are continuing to reduce that distance so that, but more importantly, we have also put very strong community health program that actually ensures our maternal mortality, our immunization, all these are going to be in the positive direction. And I think we are going to do towards August a review of our community health strategy, which actually is being looked at as one of the best in the country.
All right, Governor, thank you for that.
I really we could talk about.
Yes. I've really run out of time here, Governor, but thank you for expounding on that issue right there. Dr. Mohamed Kuti, COG Health Committee Chair and Isiolo Governor as well. And thank you so much, Dr. Mwachonda Chibanzi, Acting Secretary General, KMPDU, Jerotich Sei, an active citizen. Nerima Wako Jiwa, Executive Director, Siasa Place, and Paul Masese, tuning in all the way from Nakuru. And thank you all for all the feedback we've seen. Let's do this again next week. My name is Trevor Mbija. Always a pleasure having you with us. This has been the Monday Report. On behalf of the entire team, thank you so much for watching.